I'm Janann Reed, and I'm an associate professor in sociology and global health, and I teach the research methods in global health to the master's students. Many of these students are only in the field for 6 or 7 weeks, and they are tasked with getting as much data as possible, and then coming back from whatever global health site that they're working in, and compiling all of the information to use for whatever research purpose they have. Well, it's important to be able to use all technology that's available. Laptops are, I won't call them dinosaurs, but in terms of going out into remote areas and collecting a lot of information, for example, surveys or interview data, we need something that's quicker, faster, smaller, more versatile. So when the iPad opportunity came around, or iPads came out, I thought it would be a great opportunity to learn how to use iPads in the field, to maximize technology, to be efficient, to collect data that they can use once they return.
My name is Ayaba Wardlow. I'm going to be doing a combination of clinical work and research. I'll be working at the KCMC hospital in their OB/GYN department, and I'll also be doing some research in the community in one of their community health centers. One of my primary projects is some qualitative interviews with providers and women receiving prenatal care about the current quality of care of the services that they receive, as well as if they'd be interested in receiving some of those aspects of care in a group setting. And the reason that I'm looking at this issue is because, well, there's multiple reasons, but one, we know in Tanzania that over 90% of women receive prenatal care, and yet they still have among the highest maternal mortality rates. So I am planning to use the iPad for the qualitative interviewers. So we know that after qualitative interviews, there's a lot of unspoken words that don't get captured on the digital recordings that we'll be having during the interviews and the focus groups. And so the interviewers are encouraged to write down sort of salient thoughts that come to them throughout the interviews, as well as any particularly emotional conversations. For multiple reasons, I think the iPad would be a good technology. One, saves paper. And secondarily, I think that it will be a good interface to kind of make sure that all of the information stays in one place, and I can easily kind of sync it with my computer. It would be nice to be able to use the iPad for more things, but given some of the confidentiality issues around patient data, it doesn't seem quite feasible yet, but as things progress with iPad, hopefully we can use it for even more patient-sensitive thing. But I think the ability to have things computerized, immediately electronic, really helps to keep the research organized, helps to keep the thought processes of folks organized, and we'll be able to access things in real time right away.